COVID-19 is spiking again in Massachusetts with over 1,000 new confirmed cases per day for the past few days. Earlier this month, Needham turned to yellow from green on the state's coronavirus risk map, only one notch from the high-risk color red. Although Needham has since returned to the green category, Public Health Director Tim McDonald is concerned about the increasing cluster cases and close contact cases among youth outside of school. At the Select Board meeting on Tuesday, October 27th, he said the trending cases probably would bring Needham back to the yellow category in the next few weeks. He also urged people to continue to be vigilant and to limit their social activities.
We've had 7 clusters of cases since mid-September. Before that, we had no clusters since early May. And a cluster, by the state definition, is at least 2 confirmed cases from different households with a shared exposure. We're seeing a really significant increase in the number of close contacts of cases, especially the close contacts of youth. With school back in session, we've yet to see sustained transmission in the Needham Public Schools, but we have seen a number of school-aged youth who have gotten COVID through social activities or through exposure or athletic events. We, over the last 3 weeks, have seen the average youth average youth case of COVID have 15 or more contacts, which is a very high number. And bear in mind that I said that was outside of school. It would have been, if they had been infectious when they were in school, that would be much higher again. But these are people who were playing as part of a sports team and, were exposed through that route or exposed their teammates. So I think it's a cause for concern for myself and for the public health nurses, as well as for the Board of Health, the total number of activities that people are engaging in, and every new activity that people choose to do is a risk. It increases the number of social contacts you have, and that's a strong predictor for the increase in viruses. I think many people sort of consider the fact that we can do everything that we used to do, we just have to do it with a mask or with a little bit more distance. And I think that's not the right message. I think what we're hoping, the Public Health Division and the Board of Health is hoping to really instill on people is that they need to prioritize their activities. They need to decide what are the really critical functions they want to have happen and limit some of their other activities to make sure that they can still do those critical things. So if school is a critical activity, and I'm pretty sure the superintendent would say it is, then the number of additional activities like extracurriculars or athletic teams, parents need to balance how many of those they're going to have a young person participate in. We've had a number of sort of, very active, high-achieving Needham students that are playing on, multiple teams in multiple sports, all in the fall. In the coming weeks, you'll see the Public Health Division trying to reinforce this message. The general concept being that there's a sort of social budget you should afford yourself. And if you are constantly exposing yourself to more people, you're increasing your potential for exposure.